Hello everybody, Jeremy Latham here, I'm the hip surgeon. In today's episode I'm going to tell you about what to expect if you come in for hip replacement surgery, a little bit about how to treat your symptoms and perhaps how to avoid having surgery altogether. If you've got any questions or comments, please get in touch. If you like the channel, please subscribe. Thanks for watching. Arthritis is one of the commonest conditions that can affect humans. In the United Kingdom, nearly 1 in 3 people over the age of 50 will have arthritis at some point in their lives. In this presentation, I'm going to talk about how arthritis of the hip might affect you and what treatments are available. We'll talk particularly about hip replacement surgery and the risks and benefits of that. There are 2 main types of arthritis. In inflammatory arthritis, the joints swell up and become very painful quite acutely. These types of arthritis are often treated with drugs which are very effective these days. The commonest sort of arthritis that we see is osteoarthritis, so-called wear and tear. Here's some pictures of people with the 2 different types of arthritis. Inflammatory arthritis, such as rheumatoid arthritis, commonly starts in the hands, and you see people with hands that are quite deformed because the joints are swollen and have affected the muscles and tendons in the hand. In osteoarthritis, one tends to see lumps and bumps in the small joints of the fingers and wrists. This is the type of arthritis that commonly affects the hip joint. Why do we get arthritis? Osteoarthritis is certainly more common as we get older. Women seem to get it more than men. There are clearly genetic influences, as it seems to run in some families. Sometimes it can be caused by problems in childhood. There are conditions such as dysplasia of the hip or Perthes disease, which can predispose people to getting arthritis at a relatively young age. Repeated trauma to the joints, such as playing contact sports like football and rugby, can cause damage to the joints, which results in osteoarthritis later on in life. Heavy labour is known to cause arthritis, particularly in men of working age. Here's a radiograph of the pelvis and a diagram of someone with arthritis of the left hip. In this case, the arthritis has been caused by dysplasia of the hip. This is a condition where children are born with a shallow hip. It more commonly affects women than men, and the symptoms usually present in someone in their 30s or 40s. If you've got an arthritic hip, what can you do about it? You can take simple analgesics like paracetamol and also use anti-inflammatories such as Nurofen or Voltarol. Some people like to use a walking stick because this relieves their pain and keeps them going for a bit longer. It's always a good idea to lose weight if you are overweight, because this will reduce the forces acting on the hip joint and hopefully will reduce the amount of pain you get. Slow down, stop doing those activities which aggravate the pain. This can work for a while. Sometimes we inject the hip joint with some steroid. This can often relieve symptoms for quite a while, often for several months. Some people like to take things such as chondroitin and glucosamine. These aren't drugs, they're more like food supplements. There's not much evidence that they work in the short or longer term, but some people find them helpful. Some people like to use things such as magnetic or copper bracelets. Diet can sometimes affect the symptoms you get from arthritis, but there's no real hard evidence to suggest that any of these treatments are particularly effective in the longer term. So you've tried all of those things and none of them work. What's next? Well, then you come and see someone like me and we can talk about what treatments might be helpful for you, particularly in terms of surgery. Hip replacement remains the best treatment for an arthritic hip which is painful and causing disability. It removes the diseased joint, relieves pain and restores function. It is, however, big surgery and not to be undertaken lightly. There's always the risk of complications, some of which might be life-threatening. If you're about to have a hip replacement, what can you expect? We usually bring you in on the day of surgery and you stay for 3 or 4 nights. You'll be tired and emotional for several weeks after the operation. I get my patients to lie down for at least an hour twice a day and ask them not to sit for more than half an hour because this makes the hip stiff. You can usually drive after about a month or so, and during the first few weeks you'll have physiotherapy to help you get back on your feet and restore your confidence. Most people have reached 90% of their recovery within about 3 months of surgery. The wound isn't particularly long, usually about 6 inches or so or less. There are, however, risks to life and limb with surgery, and we'll discuss these with you when you come up for your assessment. Here's a really good evidence-based summary of the outcome of hip replacement surgery. Within 2 years, 90% of people say that all or most of their hip pain has gone. The risk of serious complications is very low. Some people might have to have repeat surgery if the hip were to dislocate or become infected. The risk of dying within a few months of surgery is very, very low. Hip replacement surgery is one of the best operations that's ever been invented. It's helped tens of millions of people over the last 60 years to get back to normal life. New developments happen all the time. New implants become available. If you've got a painful arthritic hip, come and see me and we can discuss the options for treatment that could help you. No one looks forward to coming in for hip replacement surgery. I hope this information has been helpful to you. Please get in touch if you've got any questions. If you like the channel, please subscribe. I'm Jeremy Latham, I'm the hip surgeon. Thanks again for watching.